Obesidad, arte o ciencia, el impacto en la personalización del tratamiento. Dr. Robert Kushner, hablando con su paciente acerca del peso corporal.
There's also been a very interesting movement in the United States from the American Heart Association called Life's Essential 8 for Cardiovascular Health that puts weight in perspective as a marker of health. And I find that very helpful in talking to individuals who are concerned about their weight and the language being used, that you're not pointing out that weight is the only problem they have, but it's one of the health markers that they need to look at. So they divide these 8 health markers first into health behaviors, where we talk about getting individuals not to smoke cigarettes, getting adequate sleep, 7 to 9 hours per night would be ideal. Choose a healthy diet that's with high diet quality as well as a pattern, and get sufficient physical activity. So those are the 4 health behaviors we talk to patients about. There are also 4 health factors that we talk to patients about, such as maintaining a healthy blood pressure, blood lipids, blood pressure, but also a healthy body weight, and it's measured in body mass index. So I find putting weight as a marker of health is a very useful way of communicating why you're bringing up weight with that patient, if you, again, couch it in the terms of overall health. So once we have an individual who may not have a healthy body weight and you want to encourage them to become healthier, it always starts with lifestyle counseling, and very few patients would argue about how to get healthier through choosing healthy lifestyle behaviors. And one of the targets we choose is diet, the probably the most important target that we choose. We're looking for patients who are sedentary and increase their physical activity. Individuals have low exercise capacity, such as shortness of breath by climbing up stairs. We're going to be counseling them on an unhealthy diet. So if you have a patient with high caloric intake, a lot of sugar-sweetened beverages, or intake of ultra-processed foods, those would be good targets for you to work on. Certainly smoking has an effect on body weight, sleep deprivation and insufficiency, and those that have a lot of stress. So these are targets for an unhealthy diet that will affect body weight because they're all related to weight. And we could also talk about a healthy diet. We're going to be emphasizing the items on the left, such as fruits and vegetables, whole grain foods, healthy sources of proteins, and minimizing the items on the right, beverages with added sugars, ultra-processed foods, alcoholic beverages, and so forth. And notice at the bottom of this scale where I put a red arrow is that you want to adjust energy intake to achieve and maintain a healthy body weight. So once again, body weight is an important marker of overall health, and we can get to that by choosing a healthy diet. Similarly, we can talk about getting increased physical activity. I like this term a movement portfolio because it talks about having individuals become more healthy in multiple ways. In the middle of this figure, we talk about activities of daily living by getting into work, at their activities at work, transportation, school, and household. Towards the left is talk about exercise, aerobic exercise, as well as strength training. And towards the right is something we want to reduce rather than increase, and that is sedentary behavior. So focusing in on increased healthy eating and increased physical activity will help them with their weight, which is a parameter of overall health. One of the things we often ask our patients to do is to track their steps, often with a wearable or with smartphones. And patients often ask, well, how many steps should I acquire? And this is a very interesting study, came out of the United States, where it looked at step counts for the mortality rate from cardiovascular disease on the left or cancer towards the right. And what you could see is mortality rates drop the more steps that you take. And the sweet spot seems to be about 8,000 to 10,000 steps per day, in which individuals who achieve those amount of steps compared to those who do not achieve many steps are likely to have reduced cardiovascular disease and reduced cancer. Again, parameters of health. We also want to tell our patients, in addition to lifestyle management, that modest weight loss can have an impact on their overall health. This is hopefully some patients will be interested in. You can improve their glycemic control if they have prediabetes, reduce their triglycerides. We can increase their HDL cholesterol, reduce their blood pressure, potentially reduce fatty liver disease, and very importantly, increase their quality of life. More weight loss, however, is needed to improve NASH or reduce cardiovascular events and remission from type 2 diabetes. The greater amount of weight loss often needs pharmacotherapy and other aggressive interventions that you can also talk to your patient about if they're interested. So in conclusion, it's very important for you to recognize the importance of body positivity and body acceptance. It's becoming very important these days when we see our patients, and using the right words matter. I would encourage you to ask permission to talk to your patient about weight and inquire about the patient's personal views and goals regarding weight. You may want to construct a life events weight graph. It's a useful method in order to take a weight history that you will improve also patient-physician interaction and communication. Body weight is one of many markers of health. I think patients can learn to understand that. And lastly, focus on healthy lifestyle behaviors such as diet, physical activity, sleep, stress, avoidance of excessive alcohol use, and if needed, also consider pharmacotherapy for weight if it's indicated for the patient and they're in agreement. Thank you very much.
IFA Celtics, Salud Metabólica.